Hi, I'm Dr. Brandon Elnekaveh, and I'm a plastic surgeon here at the South Florida Center for Cosmetic Surgery. Today we're diving into one of the most transformative procedures we can do on the face. That's the facelift. Let's talk about what it really is, who it's meant for, and how it all works. Because the procedure is a lot more customizable than people realize. As we age, a few things happen to our faces. First, the skin loses its elasticity. Next, volume loss leads to deflation of the face and flattening in certain areas. And lastly, gravity, of course, takes a toll, where we get jowls and certain contours of the neck that change. A facelift is used to address all of these areas, helping to restore a more youthful and refreshed appearance. A common question I hear is, when is a good time for me to get a facelift? The answer is not necessarily in your 60s. It could be in your 40s or 50s. It could even be after a significant amount of weight loss. Whenever you're starting to get jowls, neck laxity, deepening of any folds, that's a good time to get a facelift. Or if you just want a more youthful and refreshed appearance, because earlier intervention can often mean a less invasive approach. A facelift typically targets three major areas: the cheeks, where gravity can pull that downward and volume loss can lead to flattening of the area. Second, the jowls, where descent of the lower face can obscure the jawline. And third, the neck, where you could have extra skin, or vertical platysmal banding, or extra fat that can be removed. Let's talk about the different types of facelifts we offer. The first is the traditional or full face and neck lift. This involves incisions in front and behind the ear, into the sideburns and the occipital hair. By doing this, we're able to lift up the skin and target the SMAS layer, the thick fascial layer that's just deep to the skin. So we pull that SMAS layer up, and then we reposition the skin accordingly. With this technique, we're able to address the cheeks, lifting up that area, the mid-face, where we lift up on the jowls, and then of course the neck with another incision just below the chin. I'm able to do a corset platysmoplasty, basically bringing back those platysmal muscles to the center so that you don't have those vertical bands underneath. Let's talk a little bit about that SMAS layer. That's the layer that's just underneath the skin, and it connects to the platysma muscles underneath. That SMAS layer invests all the facial muscles, and it's a thicker layer that we can control with the facelift. What we're able to do is a SMAS plication, or folding in that SMAS layer onto itself and lifting that area up. By doing this, we're improving both the face and the neck in one procedure. It does require significant downtime, but most patients really just complain about tightness. Recovery usually takes 2 to 3 weeks, with swelling and bruising gradually subsiding. A good facelift will turn back the clock about 10 years and will also last about 10 years. The next type of facelift is called a mini facelift or a short scar facelift, and is best for patients typically in their 40s or 50s. It's great for those who are beginning to notice jowls and loss of volume to the cheeks but don't quite need a full facelift yet. Using a shorter scar that's hidden in the creases in front of the ear, I'm able to lift up the skin, perform a SMAS plication to lift up that SMAS layer, and reposition the skin on top of it. This addresses that cheek area and the jowls as well. The benefits of this is that I'm able to use a shorter scar and patients can have less downtime, but I'm still able to address the cheeks and the jowls, lifting it up and giving a more youthful and refreshed appearance. Most patients return to normal activity within several weeks, and the bruising and swelling is a little bit more manageable. As for the results, they typically last about 5 to 7 years. Third, it is possible to address only the neck. Patients with loose extra skin, vertical bands, or excess fat can have all these areas addressed. There are 2 ways to address this. One is with a similar facelift incision. That's the incision behind the ear and also underneath the chin, where we can address the neck, the platysmal bands, and the excess fat and skin. So it's similar to a full face and neck lift. The second option is a direct neck lift. This includes a Z-shaped incision in the neck from just below the chin to just below the Adam's apple. And through this incision, I can address the platysmal bands, the fat, and the excess skin as well. A direct neck lift is a great option, especially for men who have only localized neck complaints. It can also be done under local anesthesia or awake. The benefits of a neck lift is that it creates a more defined neck and jawline. You can combine it with different procedures as well. The downtime for a neck lift is several weeks, just like with a face and neck lift, unless we're doing that direct neck lift, in which case it could be less, closer to 1 or 2 weeks. And the results should also last about 10 years. And finally, we have the thread lift, which is for patients who have mild sagging and just want small improvements, typically for patients in their 30s and 40s. This is a temporary, minimally invasive lift for patients who want subtle improvement without surgery. We use special dissolvable threads made of PDO, which is essentially the same suture material we use for mask plication. Just by injecting some local anesthesia, we can put that thread into the correct position to get a nice upward lift. These threads work in two ways. First, lift up the tissues, and then with time and multiple sessions, they can also stimulate collagen. It can be done quickly in the office with just local anesthesia in under an hour. Often threads are combined with other non-invasives such as Botox, fillers, or even lasers to resurface the skin. So if you want a quick office procedure with minimal downtime, not too much pain, and just a subtle improvement in the laxity of the skin or lifting up the skin, then a thread lift can be right for you. The threads take about 6 to 12 months to dissolve, so that's how long the results typically last. Remember, this is not a replacement for surgical facelifts. There are several adjuncts to facelifts that can be done either at the same time of the surgical procedure or afterwards to really enhance the results. First is fat grafting, next is lasers, and of course eyelid surgery. Fat grafting involves doing liposuction of certain areas of the body and adding that fat to areas that lost volume, namely the cheeks. Eyelid surgery can help with hooding of the eyes, removing skin, repositioning the brows, and removing any fat from below the eyelids. After recovering from a facelift, lasers can really help with skin resurfacing, changing the texture of the skin, and helping with the fine lines that facelifts can't really touch. A facelift can do a lot on its own, but combining it with multiple procedures can really be transformative. Before your procedure, we'll make sure you're in good health. Make sure to stop smoking 4 weeks before and after surgery, and avoid any other medications like blood thinners such as aspirin and Aleve before the procedure. If you're considering a facelift or just exploring options for facial rejuvenation, give us a call or visit our website. We're here to answer your questions and create a plan that's tailored for you. I look forward to meeting you soon. If you found this video helpful, give us a thumbs up, subscribe, and we'll see you in the next one.